Welcome. We're so glad that you're here. Today's session is all about T1D and emotional burden. We'll begin with some quick introductions and then some housekeeping, and then we'll get started. Kathryn, will you please introduce yourself?
Absolutely. My name's Kathryn Ward. I'm a licensed clinical social worker and I'm the diabetes supportive counselor here with Blue Circle Health. I have worked in the T1D space for a number of years. I don't live with T1D, but it has touched my life personally and is a topic that's very near and dear in my heart. And I am just so happy to be here with all of you and really appreciate the opportunity to be able to connect with everyone this evening.
Great. Thank you, Kathryn. And my name is Scott Johnson. I'm the Senior Manager of Community here at Blue Circle Health. I've lived with type 1 diabetes for 44 years, and I just really appreciate you allowing me the honor and privilege of hosting today. In terms of an agenda, we've got a great presentation that Catherine will guide us through. And as you can imagine, there is a lot to cover with a topic like this. We'll do our best to get through everything, but even with that, we're only scratching the surface here. Before I get going too far, I do need to cover some quick housekeeping items. We welcome and encourage you to use the chat feature along the way. It's a great way to share with the group, and I'll keep an eye on it throughout the session if you need anything while Catherine is presenting. We're also happy to take questions along the way, and there are also a few opportunities where we're looking for you to contribute to the conversation. If you have questions or want to share, you can use the raise hand feature or just let us know in the chat. Either way, once we know you'd like to share, I'll press some buttons on our side to bring you on screen. But don't worry, your camera will stay off. You may need to press allow to unmute your microphone. And I'm also going to keep an eye on the time. And if we start running tight, we may not be able to get to everybody, but we'll do our best. And then one last quick thing about the chat, you'll see a setting there where you can pick to send chat messages to everyone or just the host and panelists. Be aware of that setting when you're chatting to make sure your message goes where you want it to. And just a few more things to mention. This session is being recorded. Participation in this event is completely voluntary and you may choose to leave at any time. Participation may reveal your identity and any identifying information that you share with other group participants, for example, comments in the chat and during discussions. And finally, we're not providing medical advice, individual or otherwise, nor are we providing mental health assessment or intervention. And we may refer you back to your healthcare team for detailed and individualized care. Okay, I know that was a lot. I really appreciate your patience with me while I have to go through some of the business aspects of it, but I think we're ready to get on with the good stuff. So, Catherine, please take it away.
All right. Thank you so much, Scott. So, to begin, I think before we can even start to talk about emotional burden related to T1D, it's really essential to talk about diabetes distress. Um, Here at Blue Circle Health, we use an instrument called the DDAS or the Diabetes Distress Assessment Scale. And it's really intended to get at distress that's specific to people living with T1D. There are other scales that are used. There's the DDS, and that's widely used and it's been around for a lot longer, often used in both type 1 and type 2 settings. The DDAS is specific to T1D. And really, if you notice on the slide, breaks down all of the different sources of distress that arise for the person living with and managing type 1 diabetes. So, looking at areas related to maybe management difficulties or worries about hypoglycemia, feelings of shame or worrying about complication, just all of the different things that come up, the sources of distress. Because unfortunately, living with type 1, there are a number of sources of distress. And then if you notice the top column there, that standalone column, that's the core or the emotional burden that someone may experience related to all of these different sources of distress. And that really helps us understand exactly how severe the emotional distress is that someone's experiencing, related to one or maybe several or even all of these different sources of distress. So, what is distress exactly? It's actually a really common and expected emotional response to the constant demands of living with and managing type 1 diabetes. ADA says that for about 1 in 4 people living with T1D, there's going to be an experience or an episode, maybe for several years, of pretty severe diabetes distress. What diabetes distress is not, as it's not a mental illness. It's sometimes mistaken for depression. There can be a lot of overlaps in symptoms of depression and diabetes distress. But depression tends to impact someone across multiple areas of life, whereas diabetes distress is usually pretty specific to the T1D related stressors that someone's dealing with. Um, Diabetes distress is absolutely not an indicator of weakness or an inability to cope. Again, this is a really uh, common experience that people have, and it's not a moral failing. I've talked to folks who have said things to me like, I'm managing pretty well. My A1C is in a pretty good range, and I have what I need. And it's not like this is some terrible disease like cancer or, something where I'm really debilitated. And while I appreciate that kind of wanting to recognize that it's absolutely possible to live well with diabetes and to function well and to have what you need, it's also really okay to feel burdened by it from time to time because there is a lot that goes into managing diabetes. So common things that come up when I'm talking to folks about some of the emotions that they're experiencing are fear, anxiety, worrying about things that may happen, or worrying about things that have happened in the past and if there's a risk of that happening again. Feelings of anger, frustration. Sometimes people feel embarrassed about living with diabetes, maybe because of stigma, maybe because they, have heard from others, maybe that are close to them, that there's some criticism about how they're managing their diabetes that they've internalized. Feelings of sadness, feelings of overwhelm. And love this illustration of the iceberg when I talk about kind of the emotional landscape of type 1 diabetes because the reality is that for people who have a fully functioning pancreas and don't have to make dozens or hundreds of decisions every day to take care of their blood sugar, is that when they think about diabetes, for most people, all they see is this little bit that's on the surface. They may see someone wearing a CGM or a pump, but what they don't know is that that person with a CGM or a pump may have been up for 2 hours the night before because that CGM has been going off or because the pump malfunctioned and they've had, problems with absorption. Or they may not realize that this friend that they see at this wedding everybody's attending has to do all of this mental math before they think about, "Ooh, am I gonna have a piece of wedding cake? Well, gosh, how much insulin do I have on board? And, what am I gonna need for this cake? How do I expect it to digest? Am I gonna do the electric slide later at the dance? Because that activity might have some implications, right?" So there's all of these decisions that are being made in the moment. The rest of everyone else at the party who's dancing and having champagne isn't even thinking about, right? So that's that piece that's really underneath the surface that I think can feel pretty big at times for the person living with diabetes. So some of the sources of distress, and again, these are captured as well in the DDAS, but worrying about blood glucose variability. So, sometimes I'll talk to someone and they'll tell me that they feel really, really worried about having a hypoglycemic event, worried about not being safe if they have a low blood sugar, worried that they might pass out or do something that might cause them to feel embarrassed if they're in a public setting, or people worrying about high blood sugars and what does that mean for the long term. Fear of complications is something that I think many people living with type 1 diabetes worry about. According to ADA and some of the some of the literature, that's one of the biggest fears that people experience is what's going to unfold in the future. Um, Financial worries is another big one. Certainly when people are faced with a situation where they're having to think about, goodness, do I pay for everything that I need, or do I have to make decisions of cutting costs somewhere else? Maybe savings, or even cutting costs with other very basic needs. Um, the diabetes police, another source of distress. And the diabetes police just refers to people that someone interacts with, either maybe their physician or their partner or their mom or friends or family, who maybe have great intentions and like to tell them what they should do about their diabetes and what they should eat, and all of this advice that sometimes doesn't feel great, right, and really can be internalized as criticism or judgment, and contribute to some feelings of embarrassment or even shame. And then feeling like a burden to others. I've had people say to me, "Gosh, I worry about one day being a burden to my partner if something goes wrong, if experience a complication." Or I worry that my children may have to take care of me someday. Or people even feeling like a burden right now because they recognize the significant cost of diabetes to their household. I mean, the actual tangible dollars and cents cost of type 1 diabetes, and feeling like that creates a burden on the household. So these are a few. I really also love to hear from experts in the field, opinions and information from experts in the T1D space. And so we've carved out a little space for that here for an expert panel discussion. And so the expert panel here in the room is all of you joining us this evening who are living with type 1 diabetes. I'd really love to just open this up. If others have, emotional things that have come up that they experience that maybe I've missed, or maybe that they'd like to, go into a little more depth about, or other sources of distress, or just any thoughts about anything that's come up so far, um, by all means, feel free to raise a hand, throw it in the chat. I just want to make sure that all the experts in the room certainly have an opportunity to weigh in here.
Thank you, Catherine. Yeah, certainly let us know in the chat if any of this is resonating with you. You'd like to come on screen and share. We certainly would love that as well. Don't worry, your camera it won't turn on, but you're welcome to come on and share a little bit. I know I certainly have felt many of the things that you talked about, Catherine. Financial worries, it's always a thing, especially in the today's economy. And it seems like diabetes is just gets more and more expensive as time goes on, and insurance covers less and less, or we have to pay for more percentage of insurance. And that's for those of us who are blessed to have insurance. A couple of comments coming in, working with technologies and having to spend time on the technical support when things go wrong. Great comment.
Absolutely. I believe I saw someone ask, "What is the electric slide?" So I just wanna take a moment to diverge from diabetes distress and emotional burden. Electric slide is this dance that is done at weddings or big parties a lot. I'm gonna spare you all from singing the song that goes with it, but it's this choreographed dance, and usually everyone will get on the dance floor, but it's very active and it can be a lot of fun. So I like to use that in that discussion of what all unfolds at the wedding, because it's something, if someone's moving around a lot dancing, that's something that can impact their blood sugar. Thank you for that
Yeah.
question.
Yeah, great question. Another thing that comes to mind specifically around kind of distinguishing between diabetes distress versus other things that might be going on, say a, a diagnosed depression or something like that. It's really all about starting the conversations with your healthcare professional to get to the kind of the core of the issue so that you can be treated properly. For example, if you're dealing with something specific that's causing you a lot of diabetes distress, and antidepressant medication isn't going to help that at all. And so there, it can be sort of a curvy road to figuring out where you can find some relief there.
Absolutely. Absolutely. Thank you for that, Scott.
And good feedback on the slides. We'll certainly take that into account too. Saying it was just a little bit packed with information and hard to see. So apologies about that. But
Oh,
uh,
thank you for that feedback. Okay. All right. So, one thing that I think most people living with diabetes, type 1 diabetes, can agree on is that it's not a lot of fun, and in fact, T1D kind of sucks. So what do we do with that? How do we begin to shift that emotional piece where the the parts about diabetes that really create a lot of burden don't take over, right? How do we live well with diabetes? What do we do on those days? What can someone do when diabetes is feeling really hard, really discouraging, really overwhelming? So, one thing that's pretty simple, but that sometimes human beings just forget is it can be helpful to take a step back and just recognize, okay, what is within my control here and what's outside of my control, right? I can control how I respond to things that are stressful and feel hard. I can control my effort, control my expectations, and my self talk. Um, I say self talk with some caveats, and I think that's also true with how I respond and expectations because sometimes. If someone's been experiencing pretty prolonged distress, or even if someone's experiencing more, some symptoms of depression or anxiety, that self-talk can become pretty automatic. And in cognitive behavioral therapy, we even talk about, unhelpful thoughts or cognitive distortions, right? And just automatic sort of ways of thinking about things that we don't even realize, but it can kind of keep us stuck in this loop or this feedback loop of feeling kind of down or feeling kind of anxious. And so there's an opportunity to work with some of that self talk, but sometimes it takes a little bit of awareness that it's even happened, being able to recognize that, okay, this story or that I'm telling myself is actually maybe not entirely accurate, maybe not entirely helpful. It can be framed maybe in a more helpful way. Of course, recognizing what's out of my control, right? So being able to recognize what we can't control and just letting that go can clear up a lot of emotional space, right? So just acknowledging the fact that we don't really have control over other people's actions, their expectations, their behaviors, their opinions. We can certainly advocate, we can educate, we can set boundaries, but at the end of the day, um, when people don't show up well or they show up in a way that's difficult, that's kind of on them, right? Um, the past. I've often, heard from folks that there's just maybe some sadness or some guilt or feelings of just frustration over how things have gone in the past with management. Maybe when they didn't have the right support or they didn't have the right information. I mean, I've even talked to people who didn't even have the right diagnosis for a long time. And have been living with type 1 diabetes for years, but were actually being managed as if they were living with type 2. Right. So just acknowledging that those things are, the past is something we can't control. We certainly grieve. Um, but, the more time that we kind of stay there, the less opportunity that there is for us to show up in the moment. Same as the future. We don't know exactly how it's going to unfold. We can make preparations, including, putting in the effort with diabetes management because it matters, making preparations for things like saving for retirement or for the kids' college or, all the list of things that we want to do to set ourselves up for a better tomorrow. And also recognizing that really, um, the moment that we all live in, the most important moment is the one that we're in right here and now. And how are we showing up in this moment? And one other thing that's sometimes absolutely outside of someone's control is their bleeping blood sugar. And so I want to just invite a brief moment for audience participation. You can use your emojis, you can use thumbs up, or other emojis that feel like they may be more appropriate. But for anyone in the audience who lives with type 1 diabetes, who's had an experience or maybe many experiences where you do absolutely everything by the book, that you feel like this is going to set me up, that blood sugar is going to be smooth sailing, and your blood sugar just absolutely misbehaves, kind of shows up like a tired, hungry 2-year-old and behaves unpredictably, uncontrollably, and completely unexpectedly. Anybody have that experience? I see a 100 emoji. Yes, I see some thumbs up. I see the horror sign. Yeah. Sometimes T1D just misbehaves. And those are the moments that it's really important to give yourself some grace. So Beyond Type 1 has published this really helpful little graphic. This is 42 factors that affect blood glucose, right? When we think about diabetes, we tend to think about, okay, carbs and insulin, food and insulin, right? Maybe we throw exercise in the mix. But there's actually all these other things that sometimes, in the moment, things go sideways and it's nothing that you necessarily did or could have done, right? Maybe the reason that that blood sugar is highly variable is because you got a sunburn on vacation, or it's really cold outside, or maybe, not enough sleep, or disrupted sleep. Maybe there's a lot of stress at work, or maybe you've got the flu, or maybe there are hormonal fluctuations that are contributing to this. The take home, I think, really here is that sometimes things happen and that's okay, right? It's not always about what you did or didn't do. It may be some other factor. Certainly those things aren't always controllable. There are things you can do in the moment to kind of try and right the course, but really allowing yourself some kindness if diabetes misbehaves. Um, and I want to be careful and say that even though there are times that things don't go as planned, that's okay. The good news is UND management doesn't have to be perfect, and that pretty good is actually great. So going to take a few minutes and play this clip by Dr. Bill Polonsky, Dr. Susan Guzman of the Behavioral Diabetes Institute, because it's packed with some pretty good news, with some common kind of perceptions I think that people have around diabetes and how it may impact their future, some worries people have, and some news that we can feel pretty hopeful about.
We know for way too many people, all those scary messages over time just lead to people feeling paralyzed with despair and fear. And we don't think that has to be true. And so what we like to do here at BDI is we talk about how we can, well, invert all those scary messages and talk about what we call evidence-based hope. And just to introduce that, for those of you who might be watching this saying, well, I don't have diabetes. Well, why would people get so freaked out or worried about complications? And it might be because they've seen, well, just looking at our first image here, perhaps they've seen things like this. Maybe they saw those in a magazine or television. Diabetes is a leading cause of kidney failure. Or maybe they've seen something like, blindness. Diabetes is a leading cause of new cases of blindness among adults in these age groups, etc. And we know that when people hear these messages, it matters. This is from data from our own studies that show, not to belabor everything you see on the slide, but what we know is the majority of people, both with type 1 and type 2 diabetes, report that to some significant degree, they do feel kind of doomed, that they're going to end up with serious long-term complications no matter what they do. And of course, if that was true, we can understand why people would just say, well, why would I bother managing that? So let me stop and just ask you guys, what about your experiences, your thoughts about this? We're next going to talk about some solutions to this, but I just thought we'd stop and say, does this sound familiar?
I mean, I've seen messages like this for a very long time, and I think feeling paralyzed is a very good description of it, because, you see a headline like that where diabetes is the leading cause of XYZ,
And it's very often part of a campaign that is surrounded by other information that's meant to help or perhaps motivate in some way, maybe scare me into action. But so often I don't see past that scary headline.
Mhm. Yeah, and in fact, in all of our programs at BDI, we hear that as a theme, Scott, that, you know, paralyzed, disengaged, because, if what I do doesn't matter anyway, why should I, you know, go to a diabetes education program or attend a diabetes health event or learn more about my diabetes or even bother taking that medication? What's the point?
Yeah.
So that these scary tactics can have, they're meant to raise awareness and perhaps sell products or raise attention or dollars. But for people with diabetes, beyond just knowing the risks, oftentimes these tactics backfire. They do often lead people to feel hopeless and that their efforts don't really matter.
So we think we can do better. And one of the most important ways in which we can do better is, and Susan and I have been presenting this kind of information to groups of folks with diabetes around the world for many decades, to really show that this is not exactly true. It's not diabetes per se that is the culprit. It really is the degree to which one is sort of managing their diabetes. That could either be leading to potentially problematic or not so problematic outcomes. And this is really spearheaded by work we did many years ago with a well-known endocrinologist at the Joslin Diabetes Center in Boston, or my dear friend, Dr. Richard Jackson. I always like to give him kudos for this because he's really helped us so much in beginning thinking about this. So when we present this to groups, here's what we do. And so let's start by talking a bit about type 1. And we have endless amounts of data we could show that would overwhelm everybody. But I'm going to show you our favorite 2 slides. And this is about what happens to people with type 1 diabetes who've been living with this disease for, let's say, 30 years. In fact, I just showed this to someone I was working with earlier today. And we know that there's large healthcare centers that do a pretty good job helping their patients manage diabetes, and they've been collecting this sort of information. And so here's one group. This is actually from the Steno Diabetes Center in Copenhagen. And they looked at their patient population, again, people with type 1 diabetes who had it for about 30 years. And they said, how many of these folks, what percentage of these folks have run into the scary, scary complications that we all tend to think about and lead to people being discouraged? So this is what they found. And starting on the left side of your screen, they found that about 30% of this population already had significant vision loss, severe vision loss, or gone blind. At middle column, they found about 12% already had quite significant amputations. And over there on the right, what we call nephropathy, which is kidney disease, that well more than a third, almost 40% already had nephropathy. And when we show this, and Susan, I'm sure, can tell you this, or she sees the same thing, we find that most large groups of folks with type 1 will go, yeah, I'm not too surprised. That's about what I would have expected. But if I leave this up long enough, someone will say, hey, why does that say 1978? And I go, oh yeah, forgot to tell you something. This is really, really old data. This was published in 1978. This was at a time when there was no such thing as self-monitoring of blood glucose, much less continuous glucose monitoring. We didn't have analog insulins. We actually didn't really have any convincing evidence that trying to manage your blood sugars mattered anywhere. So let's put this aside and say, well, what about the 21st century? And so we turn to a study called the EDIC trial, where they've been following another large group of folks with type 1 diabetes for 30 years, but it's the 21st century now, not back in 1978. We can ask the same question, which is, well, what percentage of those people here in the 21st century in this nice program, they had regular follow-up care for all these decades, have run into the same scary complications? Well, the numbers look like this. And whenever we show this to groups of folks, everybody just gasps, going, whoa, because you should gasp. So in this group of folks, they found that it wasn't 30% of severe vision loss, it was 1%. And amputation was 1%, not 12%. And nephropathy was, not 5-6%, not 40%. And this is really, really important. And I want to be careful. We're not saying, so this is the truth. This is what's going to happen to you. But we want people to know that this is what's possible. that things have really, really changed. By the way, this was published in 2009. We didn't have very good CGMs. We didn't have hybrid closed-loop systems. So you might expect we could redo this tomorrow. Things might look even better. But let me stop. Scott, you've been living with type 1 for 40 years. Susan, you talk about this with your patients all the time. What do you think?
I mean, it certainly makes me feel like the future is bright, and that the things that I'm doing and working so hard on are making a difference and do matter. And it also makes me think like, okay, 2009 minus 30 years, that the things people were doing 30 years ago were making a difference, and that it's important for us to continue learning about new things and keeping up with the latest in diabetes, because it clearly is making a difference.
Now, I think the other really important and hopeful part of this message of this slide is that these folks that participated in this did not have quote unquote perfect blood glucose management. And correct me if I'm wrong, Bill, I think that the average A1C of the people that participated in the study ended up being around an 8.2.
Yeah.
And so, that's also an important piece of this story, that you don't have to be perfect to have good outcomes. And I feel like that's also another part of the script around how we talk about managing diabetes over time that gets left out, because people felt like there's two speeds. There's at target or not, controlled or uncontrolled, good or bad, and that's outdated concept, and there's evidence to show that.
Every time I watch that, and I've watched it a few times now, but my heart lifts a little bit. And so, for another brief audience participation emoji piece, um, if that helped you feel excited or relieved or better, please, by all means, feel free to offer an emoji. And I see lots of hearts and some celebratory emojis coming up. Absolutely. I agree with Scott that the future is bright and there's a lot to be hopeful about. Okay, so what else can I do with big emotions? Hit. Because they're going to hit. There are just some hard days with diabetes, unfortunately. And so what can be done in the moment to kind of shift that and move it along so that these big emotions don't necessarily derail someone when they come up? So one thing that's pretty simple is just identify what's coming up, when it's coming up. Sometimes the emotions can be so big that we get sort of swept away by that big wave, get hijacked. Um, but what am I noticing when I'm distressed? What am I thinking about? Is there a particular storyline that's familiar? Maybe the person is noticing, gosh, I actually worry about complications a lot, but now I have this information from Dr. Polanski that the odds are really pretty good, based on the way that management has gone over the past many years, that I'm going to be pretty safe. Um, Sometimes, just noticing what the narrative, what the beliefs are can be really helpful. And there's an opportunity maybe to push back a little bit and to challenge whether that's a helpful thought in the moment. What emotions are coming up? When there's a lot of distress, sometimes there's one big emotion that's present. Maybe it's a big anxiety, and maybe under that is some pretty significant frustration. Maybe under that, there's just some sadness about this whole situation. Just noticing, maybe naming it. Um, and if it's hard to pinpoint the emotion, what am I feeling in my body? Because often emotions show up physically. We can feel them in a very somatic sense, right? So is my heart beating fast? Oh, is my jaw tensing up? Am I feeling knots in my gut? Just notice it, be with it. And making contact with the here and now when this happens, right? Allow the emotion to be there. So when you notice it coming up, I think sometimes a technique that may be employed is, well, let me push that down or away or distract myself. You don't have to. Emotions really come up in service. most of the time. So anxiety, for example, is really a helpful emotion. It helps us stay safe. It's just that sometimes when anxiety comes up, it's the thing that our brain or our body is afraid of is not actually a threat in the moment. Um, so notice what's happening. Approach it with kindness, with some curiosity. Is there a story there? Is there a belief attached to it? And maybe kind of the what we're noticing and what we're thinking is actually pretty aligned with the emotion, right? Maybe the person is noticing that their blood sugar is starting to get low and they're feeling anxious and they're thinking, okay, I need to stop and treat this now. And that's appropriate, right? That's when that anxiety is really helpful. It's it's all of those times when that emotion gets so big and then it kind of starts to hijack um, those few minutes and can go on for much longer. And again, questioning, is this story helpful? Is it true? How am I responding to what's coming up? The Buddha, I'm not sure if he said exactly this, but kind of a general theme is that every human life is fraught with pain. Um, we're not getting out of this experience as human beings without our share of painful uh, stimulus. We're all going to experience pain, and certainly there are some people on the planet who experience a lot more pain than others. Um, what we do with that pain, though, is where we have an opportunity to maybe move past suffering or to really get stuck, right? So the idea that is that pain is certain, it's going to happen, and our suffering is optional. How we respond to that stimulus is up to us. And so, I guess to give an example, let's say there's this difficult um, emotion that arises that's related to seeing a particular number on a CGM. I'm just gonna say 270. Let's say someone sees the number. There's this surge of anxiety. Maybe along with it, there's this surge of huge frustration because they feel like, you know what, I did everything I was supposed to do. Or maybe the thought is, oh, I forgot to do that, or whatever it is. But there's the surge of anxiety. There's the surge of upset, anger, embarrassment, whatever it is. And then along with that is, it starts the narrative, whatever it is, X, Y, Z. Gosh, this happened, and now I always mess up. Let's say that's where the narrative, and something terrible is going to happen to me in the future. Maybe I'll wind up in DKA this time, or whatever it is, and that kind of keeps the story going. And sometimes, when the emotions are really big and that narrative gets really strong and it kind of spirals into some disaster thinking, it even translates into behavior, right? So maybe the person then is like, I'm going to just fix this right here and now, and engages in the phenomenon, I think well known in the T1D space, known as the rage bolus. And so they have this rage bolus, and maybe it brings the blood sugar down. Maybe it works out great sometimes. Maybe sometimes it doesn't work out as well as the person had hoped when they did this to try and get that really stubborn, misbehaving blood sugar down. And then that contributes to some more variability. Maybe there's a drop and then, an increase again, and a little bit of a roller coaster ride. But the idea really is the response, right, to that number. So, in the same kind of looking at it the other way and considering the response to that number, that difficult input is seeing that 270 on the CGM, breathing into it. Okay, acknowledge, man, I feel really anxious about why this is looking like this. I'm feeling kind of frustrated. What's my opportunity here and now? Maybe a correction dose is absolutely called for. Maybe not. Maybe the person is aware, oh, there's some insulin on board. Maybe I can go for a walk around the driveway or have some water to help it along, whatever the case may be, whatever the action that's called for. Certainly take the action that's appropriate. And also noticing where that internal dialogue goes, right? Or that internal monologue, I guess, is the story. Oh man, I always mess this up and this sucks and I'm gonna land in the hospital. Or is it, okay, this is a moment in time. This 270 is a number and it can change. I have the power to change it. T1D is hard. T1D sucks, and I'm doing the best that I can. So I'm gonna give myself some grace. I'm gonna do what I need to do in this moment, and I'm gonna move on without getting hijacked by a number. So just kind of as an example of how that can be worked with. Um, Another thing that can be helpful is just, simple grounding, mindfulness practices, relaxation practices. Oftentimes, when there's a big emotion that's present, let's say anxiety again, fear, is breathing tends to become very rapid, starts to get shallow. Maybe we start breathing in, in the chest, and that's because the nervous system is getting ready to fight or flee, right? There's input here that, hey, I'm not safe. And so, it starts to show up as rapid breathing or clenched muscles or, other somatic sensations. And so something as simple as really paced breathing, really get intentional with the breath, doing some breath work, some box breathing, slowing it down, 4-7-8 breathing, diaphragmatic breathing. What these things do is by really intentionally working with the breath is it helps send a pretty clear signal to the nervous system that, hey, you're safe, you're okay. And it actually kind of just helps disrupt that response. Same with muscle relaxation, right? So we tend to tense up when there's big emotions, certainly again with anxiety, is intentionally tensing and relaxing muscle groups. So you could start with your face, scrunching up the face muscles and then relaxing them and noticing the contrast between them and then intentionally going through maybe every muscle group in the body and just relaxing. Tensing and relaxing is a way to kind of restore calm to the nervous system. Mindfulness-based practices, certainly not for everybody, but mindfulness is something that's gained some traction in the T1D space. Beyond Type 1 has some great articles on the utility of mindfulness when is a lot of distress. They partner with a group called the Diabetes Sangha that practices mindful meditation to help get in touch with some of the things that can feel difficult and breathe into it rather than resist or try to push away. Um, and then movement can be really helpful. Just moving your body, getting into your body, can really help. So, and it doesn't have to be a 2-hour session at the gym of Olympic weightlifting and then running sprints on the treadmill. A little bit of yoga. You can pull up a YouTube video or going for a walk or just some stretching can start to um, help someone get out of their brains, out of all this what's going on and back into their body. Someone said this to me once, an expert living with T1D was talking about, just, celebrating the wins. And I love that so much because I think as human beings, we're wired to want to solve problems, right? And so a tendency when looking at a CGM reading like this, the tendency might be to say, oh, look at that. I see there was a 30-minute dip below 70. And oh my goodness, there was another hour and 25 minutes spent above 180. And oh my gosh, and then it happened again. And, and how do I fix that? Right. And what's missed, right, when there's that immediate looking for what's going wrong is not looking at everything that's going right. So in cognitive behavioral therapy, when we look at thinking traps or cognitive distortions, one thing that's really common is discounting the positive, because we want to go right to, okay, what can I fix? But what if we start from a place of saying, oh my goodness, look at all that time in range. That's probably 70, I'm just gonna guess it. That's probably 74% time in range. That is amazing. That's around what 88 says is good. Or even if it's not 70% time in range, let's say it's 62%. Maybe the message that someone gives to themselves is, man, that's great. I'm spending more time in green than I am in any other color. And then from there, well, how do I build on that? So what was I doing during those times when I was in range? Can I, incorporate that more during other times? So really just taking in the good. So when things happen that are good, or when you're doing things with your management that it's like, yeah, maybe nailed that bolus for pizza or whatever it is take it in, celebrate it, and acknowledge what you're doing well. And then, wait a minute, finding your people. So human beings are social creatures. We are wired to connect. We crave contacts. Most of us, many of us, some of us are, more introverted, but there's still a need for connection. And I think that can be particularly powerful in the T1D space, because if you think about that slide early on, and that idea of, not that idea, that reality that, for the person living with type 1 diabetes, there's so much that's below the surface that other people can't really relate to or connect with. So finding a community of others also living with type 1 diabetes can be tremendously powerful and supportive. So this is a little graphic that I saw in a TED Talk years ago that I just thought was really sweet. So I'm gonna include that here, and there's a link that's included when we get to the end in the resources. Hmm. Oh. So I love when she knocks and there's, the person peers out and it's a little bit suspicious and she doesn't have to say a word. She holds up her finger and there's this sense of, oh, I see you, right? And the door opens and she's there among friends, right? Maybe it's a wedding and she doesn't have to explain to a single person there all of the thoughts that she's having about having that slice of wedding cake and then doing the electric slide and how to bolus for this and think about all of these complicating factors because everyone there knows those are her people. Cultivating and practicing self-compassion. Um, I think oftentimes human beings living with T1D and for human beings who live with functioning pancreases, it can be hard to find self-compassion. There can be a tendency to be self-critical. Um, Dr. Kristen Neff is one of the pioneers in like self-compassion and psychology, and she talks about three really essential components. They're the three kind of branches of self-compassion. And the first is self-kindness versus self-judgment, right? And this is in that moment, that opportunity between whatever comes up, maybe the difficult stimulus, maybe when that anxiety or frustration arises, when that person, we go back to the example of the person with diabetes seeing that 270 on the CGM and feeling, right? And right there is the opportunity, or right there is where there's the choice to either be self-critical and say, "Oh, hey, come on, what's this? Did you bolus? Or, whatever it is, right?" Or there's that opportunity to say, "Okay, well, didn't work this time. May have been something unexplainable." Um, it's okay, because T1D is hard, and and you get a lot of things right a lot of the time. So I'm going to give myself some grace. I'm going to do what I need to do in the moment to kind of move on. And I know that this is a number and numbers change. This is a moment in time. Offering that kindness rather than that judgment. And that's right in that split second. Where does the mind go? Self-judgment or self-kindness? And then common humanity versus isolation. So what often happens when emotions get really big and things feel really hard is that it can feel really isolating. The sense that, gosh, nobody gets this. Nobody can relate to how hard this is. Nobody understands how much I'm suffering right now. How can I even begin to explain this to someone else? And that might be kind of a dramatic overstatement, but it often can feel suffering can feel very lonely and like people don't understand. And what this piece of self-compassion calls for is common humanity versus isolation. And that's this very simple realization in the moment that right now I'm struggling. And that's actually part of the human experience. If we go back to that, realization and, from that earlier slide that life is going to be full of painful experiences. And so every human being on the planet, maybe this anxiety that I'm feeling right now, this sadness, others have felt this too, right? Maybe this frustration someone's feeling over that, 270 on the CGM. And everybody in that speakeasy from the last slide is going to understand, right? They've all been there or somewhere near there or really get that. So just seeing that piece kind of opens it up. It makes it wider that this is part of the shared human experience. And then mindfulness versus over identification. And this really speaks to the piece of recognizing when something painful arises is the value of attending to it in the moment, noticing the emotion, maybe noticing the sensations, noticing what the thoughts are, and not allowing that moment in time to kind of hijack you emotionally, right? That's where that over identification is, where it's just become so big, whatever this stressful situation is, that it kind of takes over and derails your afternoon or your day or your week. Really getting mindful about this is a moment in time and this is what's unfolding. And then the last one, I think that, this is something that is talked about a lot and is pretty simple and also really important is practicing self-care. Get out and walk a dog. Um, be outdoors. There's some pretty good evidence to suggest that a little bit of time in the sun, in some green space, can do wonders for somebody's well-being. Move your body. Maintain relationships that make you feel good with, your community, with your people. Talk to your healthcare team about how you're feeling. If it feels like, gosh, there's some diabetes distress, I think it's here. Let me talk to my endo because this might be getting in the way of management. Talk to your healthcare team. Join a support group. Try therapy or counseling if it's getting really big or really stuck and you need some help moving that along. By all means, therapy can be a really powerful way to process some of that. And then putting in the effort with T1D management is, essential to self-care, right? And you put in the effort not because you're going to get in trouble with your endo or your friend who's following you on Dexcom is going to text you and say, hey, 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 what are you doing? You put in the effort because, you know, the things that people do matter. Those things that you do that again don't have to be perfect, but pretty good. Those efforts matter, and you're absolutely worth the effort. So that's why you put in the effort with T1D management. And when things don't go as you'd hoped or planned, when diabetes is behaving like a very unpredictably, much like a tired and hungry toddler, is you just give yourself grace and you move on and you say, this is one of those things that's maybe outside of my control. I've got some control over what I can do from here, but this happened and I'm just going to be kind to myself and allow it to be what it is. So some of these may be helpful, some of them not as much, but I also want to invite our expert panel back to offer any other suggestions or recommendations for things that you might do in the moment that really helps if it's a tough diabetes day. What helps? What are some things you do when those big emotions hit?
And feel free to write something in the chat. We do have a few minutes, not much time left, but a few minutes if you want to raise your hand and share on screen too. It's been amazing to watch. We've got several attendees who have already experienced and love the diabetes sangha connections, and so I was so pleased to hear that. A lot of fan of many fans of walking, so lots of good feedback there too. Another vote for the
Absolutely.
diabetes. Yeah, that's great. I love seeing that.
Yeah, yeah, that's a wonderful group. And that's a way to practice mindfulness and find your people. You're kind of getting a lot of bang for your buck, your self-care buck there. I see you listening to diabetes podcasts while I walk. Yes, that is a good one. I do that too. I'll listen to the Juicebox podcast sometimes, or listen to things that are coming along in the pipeline. That's another thing that I think I feel really hopeful about. Is I think that future is so bright in terms of T1D. You think about I think about Dr. Polanski's slide from 2009, and he made that point of this was before we had great CGMs or automated insulin delivery. You think about since the time since 2009, and then you think about just the past 5 years, and every year at like ADA, there are all these new and cool things that are coming out as we're really, really making my life is getting easier and easier for people living with T1D, taking some of that burden.
Absolutely.
Um,
I just think
yeah.
there's a great comment about just, allowing yourself to feel that self-pity and just be in that emotion because it is completely valid. Diabetes is so hard and we get in situations not of our own doing where we're put in a really tough position. And I think it's absolutely great to just sit and
Mhm.
experience that emotion. It's valid as long as you don't stay stuck there. As you say, move on, which is great. I love that.
Yeah. Yeah, absolutely. Absolutely. Your emotions are valid. Here's the thing with emotions is that, they surface and they tend to move through pretty quickly if they're not getting tied up with something that, that sends this spiral, right? But it's really important to allow those emotions to feel them, acknowledge them. You don't have to white knuckle it through a hard diabetes day, right? Allow yourself to feel sad, to feel like, man, this really sucks. You can cuss if you want. That's okay.
Yeah, I've been known to do that from time to time too. So just keeping an eye on the time. I think we've only got a slide or two left, but let's go ahead and move on from here. Thank you for all of the participation in the comments. It's great.
Yeah, yeah. So just any additional thoughts or questions? And I know we've had a lot come up in the comments. And so in the interest of time, thank you so much for sharing. I'm so glad that everyone has access to those comments and can provide some support, some of that T1D community and finding your people even right here this evening.
Yeah.
Yeah.
You got a ton of this is I was going to ask you to show this slide. So this is just some of the resources that Kathryn has pulled together or mentioned in this terrific presentation. And it'll take me a few days to get the post webinar follow up email put together, but I'm going to include all of these and many of the others that were mentioned in the comments as well. So we'll have all of those in there for you. And then again, we just really appreciate you attending and sharing your time with us. We shared and talked about a lot of resources. Again, I'll include all of those. Focusing on your mental and emotional health can be daunting, but at least for me, it's such an important part of living well with diabetes. I can't do the things I need to do to take care of myself if my head isn't on straight. So I just want to say you should be proud of yourself for being here and digging into this topic. We certainly are. And it's also important that we're here for you and we're rooting for you, whether you're an active program participant or a longtime full circle community member. You're not alone out there. And then stay tuned for future events like this. I'm excited that next month we're adding a second group session during the day. So on Friday. So if you enjoy those, you're welcome to come to whichever one works best for your schedule or both if you like. That would be fun as well. So that's happening on the 6th and the 7th. The 6th is the regular time at 6 p.m. Eastern. And the 7th is going to be at noon Eastern time. There's also the Spanish group session on the 13th. Then we've got Rita hosting another cooking class on the 10th, where she'll demonstrate a chicken sheet pan supper with broccoli and potatoes. And she'll also share a vegetarian option. And for our next webinar, we'll have Sherry, and her topic is going to be T1D and exercise, and that's happening on March 19th. So lots of fun things happening for you. And we're building even more of these as well. I love that our calendar is starting to fill up with these events. So keep an eye on your email and text messages for more information on all of those. I'm also excited to share that we'll be opening these webinars and classes up to the broader T1D community very soon. So if you have friends or family who might be interested, please feel free to share the information with them. And don't worry, your information and participation in the Blue Circle Health program will always be confidential. And the group sessions is always going to be a very sacred space for you to connect with other people with T1D who have been active or gone through the program. Finally, please do share your feedback. You may see a survey come up once you close this session. I'll also include a link in the email that comes out afterwards. And, we are really looking to you to help us know what information you'd like us to teach about and groups you'd like us to bring in and things like that. So, yeah, thank you very much. And we hope to see you again soon.
Thank you so much. It has been a privilege and a pleasure, and I really appreciate all of your time this evening. And Scott, thank you so much. You're a wonderful host.
My pleasure. Thank you.
Good night, everybody.